So we are clearly in the middle of what they call the fall surge. So it's a good time for a checkup with a friend of the show, internal medicine doctor Brian Lamb from Allegheny Health Network. Doctor, thank you for joining us tonight at 7:30 for another update.
Well, thank you for having me on.
We have talked to you 3 other times now about COVID since mid-August. So we want to get back to the basics tonight and ask you, what tangible changes can people make to their daily lives to try to stop the spread now?
I think we need to go back to the basics. We've shown that we are failing miserably at controlling this virus. It's spectacular how badly we are doing right now. And we need to get back to the basics of wearing masks, washing our hands, and more importantly, we need to get back to staying away from each other. It's one of the hardest things to do, but we really need to work on, isolating ourselves and maintaining social distance protocols, whether it's with friends, whether it's with family, and really curtailing what we do. We've seen with the data tracking on cell phones, people are mixing just like we've been doing before. And it's time to really think about that and really step back from what we're doing in our normal lives.
Pennsylvania reported the highest daily total for the third straight day. Do you have any new insight in what are some of the risky behaviors that people are doing, or maybe things that we didn't at first think were risky that now we know are?
It's actually small groups. We thought at the beginning that if it's a small group, if it's people you're around, it's the same risk and you can relatively keep it safe. What we're realizing now, though, is with people going back to work, kids being back to school, you really have to look at your group because your group is probably interacting with so many more people. And it's really opening up your entire group. And so your small group is probably no longer safe if people are going outside of that group now. When we have people who aren't essential workers that are back to work, there's a lot more mixing. And so we really have to rethink that small group safety mentality.
And speaking of mixing, Thanksgiving, just 2 weeks from today, the holidays are coming up. So some people might now be reconsidering their plans. What outlook do you have for the upcoming holiday season?
Well, I agree. People need to rethink their plans. We all love the holidays. We have Thanksgiving, we have Diwali, there's so many holidays coming up. We have Christmas, Passover, we have Hanukkah. There's so many things coming up. We really need to think about how we're going to celebrate this year. It's been a rough year. People want to get together. The CDC is recommending really limit who you're with. Big family gatherings, big family parties, work parties. We really need to think about curtailing those this year to keep everyone safe. If we want to have any sort of parties next year, we really need to worry about what we're doing now.
That's not something a lot of people want to hear. We
No.
we do like to focus on good news here at 7:30. Obviously, this is a very serious topic, but I do want to ask, is there any good news that we can extrapolate out of the data or what we've been seeing over the past couple days?
Yeah, the good news is actually, although people are getting sick, we know how to treat people better. We have to remember that when this first started, we didn't have treatment. All we knew was to put people on ventilators and hope for the best. And now we actually have treatment protocols in place. Our hospitals, have capacity. We're expecting this surge. We're ready for it, for the most part. And we know how to treat people. And so the mortality rate's going down. A lot more people are getting sick. A lot more people are contracting the virus. But we're actually really helping to keep a lot of those people alive. So we're not losing as many people to the virus as we had.
How has your advice changed over the past few months, if at all?
Oh, it's changed tremendously. Back in March, I remember first saying, don't panic. Don't necessarily wear masks. That was when the CDC wasn't recommending that everyone wears masks. So we didn't think people could wear them correctly. And then it was, well, stay with your small groups. You have to have some social outlet, but keep it small, keep it with groups that are safe. So it's changing every month to every week as we're learning more and as we're seeing what's working and what isn't working. And it's going to continue to evolve throughout the winter months. We're looking at some horrible months ahead, but we have to keep evolving. So there's never one right answer. What I say today may be wrong in 2 weeks.
What would you say to people who are scared and they're upset over the fact that, back in early June, we thought that we had beat this?
Well, it's normal. It's normal to be afraid. It's normal to be scared. And it's okay to accept those emotions. It's okay to talk to people about those emotions. What you don't want to do is give up. That's the most important thing for everyone to remember. We're still in this. We're still in this together. Giving up, saying that whatever happens, happens, is the worst thing we can do. We're strong. We need to keep fighting. We need to keep doing what we know is right, to keep everyone safe. And so it's really important to try to look at the bright side. At some point, we may have a vaccine. At some point, life may come back to what we think of as normal. And so it's important to hold on, keep doing what you're doing, keep fighting the good fight, but keep hoping for the best.
Yeah, the worst thing people can do is just throw their hands up in the air.
Yeah.
Dr. Brian Lamb, thank you for offering your insight tonight and for joining us. We appreciate it.
Thank you for having me on. I appreciate it.